Hi, good afternoon. Here we are with TX team. We're here for the monthly educational presentation for our employer-based clinic partners. This month, we have Jessica Tharp with us. Jessica is a physical therapist. She is actually at one of our northern employer-based clinics here in Indiana. But today she is going to present on dizziness. And I'm going to let Jessica kind of introduce herself first, and then we can move on.
Hello, my name's Jessica, like Anne said, and I have been doing physical therapy in both the inpatient and outpatient setting for almost 20 years now. And about 5 or 6 years into that, I realized that we had a fair amount of people that were coming in dizzy, and I didn't really know how to deal with it. So I did some continuing education, and I've been treating vestibular disorders and dizziness for the last years. So it's something that people don't want to talk about a lot, but I really enjoy it.
Great.
Mhm.
Jessica, I'll go ahead and go through. We'll start the presentation. And if I miss moving on to a new slide, please nudge me. If at any time anyone who has joined us today has a question, feel free to add that in the chat, and we will address the questions at the end of our presentation. So I will move on here, Jessica, and take it away.
Great. Thanks, Anne. So we want to talk about balance first. Your body's sense of balance is made up of three different sources of input. Your eyes give input to your brain, your sense of touch, so your hands on a table, your feet on the floor, your rear end sitting on a chair, and then your vestibular system, which is in your inner ear. Those three pieces of information all come together in your brain to give your brain different bits of information that tell you kind of where you are in space. Am I upright? Am I laying on my side? Am I upside down? Imagine amusement park rides. They are really messing with all of those senses when they spin you around. That messes with your inner ear. It messes with your vision because everything gets blurry. Your sense of touch, you're obviously like hanging on for dear life to some of those rides. So it's a lot of fun because it manipulates those sources of input to your brain. But the problem is what happens when one of those things breaks, right? So some of the causes of dizziness can be medication side effects. So if you are dizzy and you don't know why, think back, is there any new medication that you've started or a medication that you've stopped anytime in the last couple of weeks? And if you can think of, oh gosh, yes, I did start this new blood pressure medication, and now 5 days after starting it, I'm getting dizzy, you definitely need to call your doctor because sometimes medication side effects can lead to dizziness. So if it's a medication you're taking, a lot of times the doctor can prescribe you an alternative medicine so that you're not dizzy, because we definitely don't want you to be injured because you're dizzy and you fall. That would be a super bad thing. Another thing that can cause dizziness is if you are overheated and therefore dehydrated. So heat exhaustion, heat stroke, and any kind of dehydration definitely can lead to dizziness. Low blood sugar can lead to dizziness. So if you are taking insulin, or if you're diabetic, or even if you've just been really crazy busy and haven't eaten and been doing a lot more activity than you're used to, low blood sugar can lead to dizziness and kind of a lightheadedness kind of sensation. Low blood pressure, for a similar reason, you don't have enough pressure to get that fluid, the blood, up to your brain to give your brain the oxygen it needs. It can give you a sense of dizziness or lightheadedness, and you can even pass out from low blood pressure. So you want to be sure that that's not going to be an issue. Infections, certain infections can lead to dizziness. There is a disorder called Meniere's disease, which affects your inner ear. That can lead to dizziness. And then my favorite one, because I can treat this and actually make you better, is called BPPV. That's benign paroxysmal, which means temporary, transient. It comes and goes. Positional vertigo. That's the most common reason for dizziness. And since it's the most common reason, I think we should talk about that. So BPPV, this occurs when things go wrong in your inner ear. The good news is there's nothing wrong with your sense of sight or your sense of touch, your sensation, your feeling. So we can fix this. But the inner ear is that third component of what tells your brain about your dizziness, about your sense of balance of where you are. So your inner ear is made up of a space called the utricle. And it has little tiny stones inside it, and those stones are sensitive to gravity. So if you're upright, the stones are all down. If you're standing on your head, the stones are all up. And it gives you, your brain, the information to tell you kind of where you are in space. Attached to that space, the utricle, are 3 semicircular canals. And these are in each inner ear. So since you have 2 ears, you have 3 semicircular canals on each side. So we're talking 6 canals. These canals are filled with fluid, and they have a membrane at one end, and they sense movement. So if you turn your head, that fluid swishes and pushes on that membrane and then stops. And if you turn your head the other direction, it swishes and then stops. If you ever played with the parachute in gym class where you can push it up and push it down, it's kind of like that at the end of a tube. So that fluid is swishing and stopping every time you turn your head. So the combination there with those little stones called otoconia gives you your sense of position and then your sense of movement. Your brain puts all that together, and even with your eyes closed, you can tell if you're laying on your left side or your right side. Like if you're in a car with your eyes closed, you can tell if you're moving, if you turn right, if you turn left. That's all your inner ear, your vestibular system. So what happens if that little system goes crazy, right? So I think this slide, I already kind of talked about it, Anne. Sorry, I messed
Okay,
up.
no problem. There
So
you go.
when that system malfunctions, that's when you have, it's called BPPV. Those little stones get out of the utricle and then they end up in those semicircular canals. So if you're used to the fluid that swishes and stops every time you move your head, and now you have those little stones inside the canals, you end up with almost a sensation of an avalanche happening. Every time you move your head, instead of just the fluid swishing, you get the stones cascading through these semicircular canals, and then they don't stop when they're supposed to. So we definitely don't like that sensation. So if the fluid has an avalanche of rocks every time you turn your head, left, right, up, down, anytime you turn your head, the signals that are going to your brain, instead of a nice swish and stop, they're amplified. So it's a louder signal to your brain and extended. So the motion feels like it continues to go on even after you've stopped moving your head. So if I turn my head to the left and then the fluid stops, but the stones are still rolling, the sensation my brain is getting is that I'm turning, and still turning. So imagine how that feels. It makes you feel a little bit terrible because your brain still feels like you're going in circles, even though you're not. So now that you know what it is, what can you do about it? So like we said, those little stones are in the wrong place. So what we need to do is stop moving your head as much as possible. And that is really hard for us because we want to say yes and no, and we want to look here and look there. And that is really difficult to not move your head. But if you are walking and you get dizzy, stop moving. Because every time you move your head, you're going to restart that little avalanche. Now, it will stop and it will settle, but it takes anywhere from 30 seconds to 2 minutes for it to settle. And then anytime you move your head, it's going to start right back up. So if you're having that, you got to get to a doctor so they can send you, or to a physical therapist directly, so they can fix your problem. There's a maneuver we can do. It's called the Hall-Pike-Dix maneuver, and then we can figure out which canal, and then we can go into the Epley maneuver to actually get those stones out of the canals. So we can fix this, but you've got to get to somebody who knows what they're doing. All right? So now you've got an appointment. What do you do until then? So remember, we talked about the 3 sources of input for your brain: your sense of touch, your vision, and your vestibular system. Imagine that like a 3-legged stool. You can sit on a stool with 3 legs pretty confidently and it is not going to fall over. But if your vestibular system is malfunctioning, now you've got one of those legs of the stool is broken or wobbly and it's not doing you any good. So imagine your brain has 3 advisors. Think old days, the kings, they have advisors. If one advisor, your vestibular system, is giving you terrible information, eventually you can stop listening. Your brain will actually start to phase that stuff out, but you cannot deprive your brain of its other 2 advisors. So do not go sit yourself in a dark room on a squishy bed and close your eyes and take a nap, because now you've taken away your vision and you've taken away your sense of touch because now you're on a squishy bed. So you've got to give your information, give the brain all the information that it can use to help get you righted and get your sense of balance back the way it's supposed to be. So stop moving your body, stop walking, stop swinging around in a swivel chair, stop moving, get your feet flat on the floor. So if you've got your legs crossed, uncross them. If you've got one leg up in the air for some reason, set it down. If you can sit down to get more of your body, your legs and your rear end and your back into a chair, do it. So get more of your body touching something that's not moving. Don't move your head. So the fluids and the rocks in there can stop moving. Keep your eyes open and fixed on a small object. So if you can look at something across the room, something small like a doorknob, a light switch, a plug in the wall, you've locked your eyes onto a smallish object so that your eyes aren't moving, your vision is stabilized, and your brain can start using that information from your eyes to say, okay, I'm not really moving. Even though my inner ear is saying I'm still moving, my eyes are saying I'm not. So your brain is going to start questioning the information it's getting from the vestibular system, and we'll start filtering that out. So once you stop, again, 30 seconds to 2 minutes to get that sensation to stop. As soon as you move your head, it's going to start all back up again. So we want you to be very careful to not fall and not get injured. So maybe don't drive either, because imagine if you're dizzy when you're trying to drive your car. That would be disastrous. So get somebody to take you to your appointments to where we can get this fixed. All right? So I think we've got maybe one more slide, Anne. Right, the conclusion, identify your dizziness, figure out, is it your medication? Is it that you're dehydrated? Is it your blood pressure or your blood sugar? Do you have some sort of an infection going on? Or is it your vestibular system? Get to a healthcare provider who can help you, a doctor or a physical therapist who can do the test to determine which of those 6 canals it's in and can do the maneuver to help empty those rocks out. So physical therapy can fix this once we identify which canal and do the appropriate maneuver to get it cleaned out. Does anybody have any questions?
Great. Jessica, thank you. I'm going to stop sharing the presentation and share a
Great.
few questions that we received. That way everyone can see you.
Yay.
Number 1, we have, is it good or bad to lay down if you're dizzy?
Actually, it can be both, but usually it's bad. The position itself, there's nothing wrong with the position of lying down. The problem is everybody seems to want to lie down in a dark room on a squishy bed and close their eyes. Remember, we talked about the 3 different advisors that your brain is using? If you've shut down your vision because the room is dark and because you've closed your eyes, your brain doesn't have any other information to go on to discredit your malfunctioning vestibular system. Same thing if you're laying on a beautiful squishy mattress, that's not giving your sense of touch any good information.
Might
So
feel good, but
it might
not
feel
good for
good,
your
but it's
brain.
not going to help
Yeah.
your dizziness.
Yeah.
Absolutely. That's another thing, Anne, I wanted to bring up. If you are having dizziness issues, wear good solid shoes. Don't wear flippy flops. Don't wear fuzzy bunny slippers, because that's not giving good input to your feet on the floor. Don't walk in grass or sand or mud or anything slippery, because again, not giving good solid input to your sense of touch. Don't walk around in low light situations. Use night lights. Don't walk at dusk or at dawn when the sun isn't all the way up, and all the colors are kind of gray. Your eyes can't use that information to give your brain better information.
Great.
Mhm.
Kind of along that laying down, someone asked, why do I get dizzy when I get up off the floor after I exercise?
Some of that could be your blood pressure. When you change positions, and it's always from down to up. So if you're lying down up to sitting up or sitting to standing, sometimes the gravity is pulling on your blood literally too hard to where you can't get the pressure up where it needs to be. And since your brain is on top, it doesn't always get your blood flow up fast enough. Now, if it doesn't settle in 30 seconds to a minute, and then it starts back up when you shake your head, oh, it might be vestibular problems.
Okay, great.
Mhm.
Will Tylenol or Advil help with dizziness?
Not really, no.
Okay. But a PT will.
Absolutely.
Yeah, exactly. And then we have one more. Are there things that I do? I guess are there things that like maybe actions they do or certain things they do that can cause dizziness? Like, are they causing dizziness for themselves?
Can you contribute to this? Well, one thing I'll tell you, once you have had BPPV, you are susceptible to having recurrent episodes. Nobody seems to know why, but anytime you're dehydrated, and remember, dehydration is more than just not drinking enough water. It can be drinking too much caffeine or too much alcohol. Those things will both contribute to dehydration. So definitely make sure you're staying hydrated with good water and good fluids. And then also, we say head injury, but I'm not talking about just getting bumped on the head or a concussion. I'm talking if you're out on a boat and you're tubing and you get thrown off the tube. That's not going to give you a concussion necessarily, but if you're dehydrated from being out in the summer sun, maybe not drinking enough water or replacing water with other drinks, and you get thrown off the tube, that could contribute. That could be enough of a head injury, quote, to give you BPPV.
Yeah, that was one thing that you mentioned, the roller coaster earlier. Summer's coming up.
Oh,
People are doing
yes.
outdoor activities. So,
Yep, a roller
stay
coaster is
hydrated.
definitely.
Stay hydrated, especially if you're doing some activity like that. Is that what you
Right,
would recommend?
exactly.
Okay.
So don't go out and not live life, but make sure you are hydrated with water, 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 water. Soda's fun. Alcohol can be fun, but it is not going to help you stay hydrated.
Right.
So water, 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 water.
Exactly. Exactly.
Yep.
I'm going to share real quick, just our one last slide we have here. For anyone who is in one of our clinics, and Jess is right here with us, you can make an appointment with your physical therapist at any of our clinics that we have. You can call that number 317-503-1907 to schedule an appointment. You can also email schedulept@txteam.com. That phone number that is listed, that will give you a general operator, and that gal will help you, will find out where you live, what clinic is closest to you, or, if you're with one of our partners, obviously say, hey, I work at this location, and they will get you in touch with the physical therapy at that location to get you scheduled and help you relieve that dizziness if that is starting to happen. Right, Jess?
Yeah, absolutely.
Okay, great. We want to thank everybody for participating. Again, if you need any help or even if you have a question, maybe you're not experiencing dizziness, or if you have any other injury or pain or strain, your physical therapist there in your employer-based clinic is there to answer all your questions. They're there to help you out. You don't need an appointment. You can email that schedule PT. We can direct that to a person who can help you with some answers. So always there. Again, thank you, Jess. And
Absolutely. You're
thanks
welcome.
everyone for attending. And you can also, we will be sending out the live link for this recording, so you can watch it at your leisure. Thank you.
Thanks.